Hey everyone! In this video, we will be covering the neurological exam, which is part of our patient encounter physical exam series, so stay tuned. All right, well, I want to thank you for joining us today on this video. And if you haven't checked out the other videos in this series, I definitely recommend them. And I recommend going in order. So if you check out my playlist up here or down in the description, you'll be able to follow along and make sure that we can start from head to toe and do the entire physical exam. Now, this video is the last video in the series of physical exam videos. However, I will do one more video with some tips and tricks on how to succeed on your practical examination. All right, so let's dive into this rubric. We have the neurological exam, which starts off with the cranial nerves. Now, if you've been following along with the videos, you've noticed that we've inserted these cranial nerve evaluations throughout our entire physical exam as they kind of fit in. And so at this point, as you get to this very last page on the rubric, you should have done almost all of these cranial nerve assessments, which is awesome because then you don't have to do them again, okay? The only one of all of these that we haven't done yet is the sensation of V1, V2, and V3 for the trigeminal nerve. Okay, and we actually cover it right over here where it says face. And what we'd like to mention here, as we want to make sure that we let our preceptor or our lab instructor know that we have been assessing these cranial nerves. At this point, you probably just want to mention that cranial nerves 1 through 12 have been previously checked and appear to be intact. And then when we get here, that would be the last assessment for the trigeminal nerve. Okay. You don't have to go one by one and say, I checked the olfactory nerve and it was fine because they could smell. You don't have to do that. But just making a statement that you're acknowledging that those cranial nerves were part of the neurological exam, I think that's the important part. All right. So right before this, we examined the upper limb, and a lot of times we'll have the patient kind of sit after they do the active range of motion of the shoulders. So you might find that your patient's sitting at this point. If they're not, this would be a good opportunity to sit back down. And we're going to start with the reflexes. Now, I think the reflexes are the most technically difficult portions of this entire physical exam. They're very hard, and I even have trouble. I struggle with getting some of these reflexes because it's hard. It's not something I do every day. I can't even tell you where my reflex hammer is, okay? But it is something that you want to practice and try to hone that skill. Ask your lab instructor or your classmates to help you. And you'll also notice that some patients are way easier to get than others, okay? So I'll also teach you a few tips to try to make sure that you can get those reflexes accurately. After we do our reflexes, we're going to move on to, as we end with the plantar reflex, which is on the bottom of the foot, we can test for vibratory sensation of the DIPs of the big toe. So we've already touched their feet. We're touching their feet for that as well. And then we can wash our hands. Okay. After we wash our hands, we'll move on to our sensation. And I'll show you how to do that. I'll show you how to assess everything. After that, we're going to do stereognosis. And we'll have two items, should be items that the patient is familiar with. So like a key, a paper clip, a coin, something that fits in one hand that they can touch and maneuver with only one hand. Okay. Then we're going to test some cerebellar function. We have a few exams for that. And as we get here to the end, we'll notice that the majority of these we've done somewhere else. So I would recommend that we do the ankle pat. Maybe when you're testing the strength of the legs and feet, you might also want to throw in that heel to shin there, because I find if I don't, when I get to this point, I kind of forget it. Okay, so that might be a good idea. And then we've already done the walking, the Romberg, and the pronator drift when we did the lower limb, or sorry, the spine exam. So that is it. That is the entire rest of the rubric. And I think let's go ahead and look at a instructional demonstration so that we can see kind of how to do these exams and the best approach to it. So we just finished upper limb. You could have done the rest of the upper limb sitting down if you wanted. So like I just had her continue standing, but after she did active range of motion of the arm, I could have her sit. So it's really up to you. You can sit down. You could do it either way, in other words. So you can still do passive range of motion seated here. I just think that the bed gets in the way, so that's why I do it all standing, but it's up to you.
All right, so next is the neurologic exam. We've already done pretty much everything on cranial nerves. The only thing that we haven't done, if we've been following the rubric as we've been going week by week, is the sensation on the face, on the 3 dermatomes of trigeminal nerve, which we'll assess when we do sensation in just a minute. But next is reflexes. I think this is one of the trickiest, most technical thing that you'll learn in a physical exam. So it's good to learn it correctly and practice it so that you're not faking it. Okay, I want you to do it well. There's 3 different types of hammers that you can buy or that you may have bought. There's this one, which is a little bit heavier, and you can switch the orientation of the mallet part to like a hammer or like this. There's this kind, yeah, and then there's this kind. This is the old traditional kind. This is the kind I like to use. This is the kind I'm going to demonstrate with because I don't want to look dumb when I'm getting the thing. So first one is brachioradialis. So for brachioradialis, I kind of find this little section. She has her hand resting in her lap in a neutral position. So you don't want pronation. You don't want to supination, just like neutral position. It's usually right about here that you do it. So you see her fingers kind of did a little thingy there. Did you feel it? Mm-hmm. Yeah. So you can either put your fingers there or you can gently strike it. Sometimes I like to put a little pressure and I feel a little bit of a twitch of the fingers. So you can do it here and then you do it on this side too. So yeah, sometimes I get it, sometimes I don't. And it depends on the patient too, but it's usually right about here that I feel it, right along the radius. So there, did you see her fingers? That's why, I don't know, this is how I do this one because I feel like it hurts when you hit their thing here, and so they don't do the twitch as well, but you can do it either way, okay? Then we come to biceps. So for biceps, we felt that biceps tendon when we were feeling for the brachial pulse, remember? So now we're gonna test the biceps. So it needs to be resting in the lap. And some patients get like hyperfixated on the fact that you're testing the reflexes, so they kind of tense up. You want everything super relaxed. For this one, because it's kind of in a little crevice here, I usually put my thumb on the actual tendon and I use the pointy part of the stick and I hit it. So she's a little bit tense, a little hard. She knows she's being watched. Yeah, but there, I felt it there. Then you do the same thing. And this one, I would come on this side. And you can also do it like this, but I feel like you can't really, you need to put your finger there. So do that. And then triceps. So there's 2 different ways to test triceps. The way I like to do it is to grab the arm, relax your arm. And I want her to really relax it, kind of like what we did with the legs for the popliteal pulse. Like if I drop her arm, it should fall. Okay, very good. She let it go. For this one, you want to feel the triceps tendon, which is right about here. And she's not relaxed, so she's not doing it. But another way to do it, can you grip the side of the bed and pull on it? Just on that side, and relax this arm. Relax, relax. There you go. Relax there. She doesn't want to do it. But anyways, you hit right about there, and it should reflex, okay? And the other side, on this side, just make sure you put yourself in a position where you're comfortable to do it right about here. And don't hit the bone, hit the tendon. I've seen a lot of students, they get like doing this like weird angles with their mallet because they can't quite figure it out. Just get in a position yourself so that it's easy to hit, okay? Touch triceps. That's all the upper limb ones. Then we do patella. So I'm going to have you sit back just a little bit. Okay, good. So patella, you find the patella, which is right here, and it's the tendon that's right underneath. It's the squishy part. And then down here is the tibial tuberosity. So your patient, you'll have skin to see, so you can better find your landmarks. But right in here is where you want. And let's see. See, she has kind of weak reflexes. No, not your fault. There, here's a little one. See, she's there. So there, it's pretty good. Not bad. So that's that. If you have trouble, you can have the patient grip their hands like this, and sometimes that'll make the reflex a little better. See?
That was me. That was me.
She kicked. Another thing, do not stand in front of your patient. Do not stand in front of your patient and get reflexes. You'll get kicked. You don't want that. Oh, I always stand here, and I'm right-handed, so for me, right-handed works best on both knees from this side. You can come on this side, but then you're like backhanding the hammer, and to me, that's harder to do. Okay. Then we're going to do the Achilles reflex, which is back here. So for this one, you kind of lift and have the patient relax, and you just hit back here. For this part, I use the the longer side of it, and just have them relax. Relax. If I drop, there you go. Why? There. You can feel the like push the gas a little. You do it on this side too. Just relax. There, she did it. Last thing we're going to test is the bottom of the foot. So for this one, you're supposed to start down here and then go up this way. It's very ticklish, but you just kind of push a little bit, and the toe should go downward, not upward. And you do it on both sides. Okay? So that's reflexes. I'm going to wash my hands. So pro move, you can use your stethoscope to double as a reflex hammer. So use the same thing here. So technically I could have waited and washed my hands after, but you're going to fling your thing, and you're going to place it on the DIP. Like right here, I think, DIP. All right, can you feel that? Mm-hmm. Okay. I want you to tell me when you stop feeling it. Close your eyes. Okay, and then do it on the other side. Same thing on this side. There, all right. There you go. All right, then we do, then we're doing sensation. So for this, you'll want to take a Q-tip and you'll break the end off of it so you have a sharp end. So you'll have sharp, dull, and soft. So for soft, you can have like the cotton swab like this. You're going to show your patient, this is dull, this is sharp, this is soft. Okay, so I'm going to touch on different parts of your face first, and then we'll move to your chest, your arms, and your legs. You're going to tell me whether it's dull, sharp, or soft, and where you're feeling it. Okay, so close your eyes.
Dull.
Yeah, where?
On my head.
Be more specific. Left side of your forehead?
Oh, left side forehead.
There you go.
Soft.
Okay. Right?
Right side cheek.
Okay.
And sharp on the left side. And soft on the right side.
Mm-hmm. Oi! I scared her. Did you see?
Dull on the
Gentle.
right side.
Anything by the eye, she's going to freak out. So test the 3 dermatomes of the face. I'm going to pull down your gown just a little bit here. It's there we go. Just to do your chest. So any of the exposed part of the chest right here is fine. So
Soft.
it's hard to tell. Dull, okay. Sharp, we get the point, right? Then we come down here, so that's soft. You're just testing different parts, and then down here on the leg. So she'll tell you what to do. All right? Then we're going to do stereognosis. So I have 2 objects. Okay, I'm going to have you extend out your right hand. I'm going to place an object in your right hand with your eyes closed, and you're going to, only in that hand, touch the object and tell me what it is, okay? All right.
Coin.
Very good. Can you be more specific? What kind of coin?
No.
No, okay. Nickel. Good. All right, other hand. Hand out.
A key.
Very good. All right. Now we're going to test your cerebellar function. So for cerebellum, we're going to do pronator pronation supination. So it's going like this, like patty cake. Okay, very good. As fast as you can. Good. Very good. Now we're going to test your coordination of your fingers. So just as fast as you can, touch all of them. Very good. Very good. Then we're going to do finger to nose. So you're going to touch your nose with your right hand. Touch my finger. Good. Good. Go slow first. Okay. You can go a little bit faster. All right. You can slow down and now close your eyes. Very good. All right. Now you're going to open your eyes and follow my finger. Okay. All right. Now do it with the other hand. Normal. A little bit faster. Very good. All right. Close your eyes. Very good. All right, now open. Now follow my finger. Good. It's pretty good. Look at that. Very coordinated. So it's about maybe a foot's distance away from her, just enough to like extend her arm out and touch your finger. All right, next on the list is the ankle pat, but I would have done the ankle pat probably when I tested for strength of the ankle back when I was doing the lower limb. For the ankle pat, you can do one at a time or both. I usually just do both at the same time. I'm going to put my hands under her feet, and then I have her pat my hands with her feet. So just go ahead and pat my hands. Very good. So you're looking for coordination. There, very good. Then we're going to do the heel to shin. So for on this one, I'm going to have you take your right heel and run it down your left shin. Very good. And I'm going to do the opposite. Boom, heel to shin. And that's it, because the last 3 things on the checklist would be the walking, which we already did, the Romberg, and the pronator drift, which we've already done. So that's it. That's the exam.
All right, now that we've looked at that instructional demo, I think it's a good opportunity to look at a demonstration of the actual practical and kind of how that would play out.
All right, next we're going to move on to your neurological assessment. As we've been going through the exam, we've kind of tested a few of your cranial nerves, actually 1 through 12. The only thing we haven't done is test sensation on your face, which we'll cover in a little bit. But first we're going to do some of your reflexes. So for this, I just need you to try to relax as much as possible, okay? Good. Relax. I know it's easier said than done to relax. Good. Good. Just relax your arm as much as you can. Okay, I want you to try to grip that side of the bed over there so I can try to get you to relax a little more. There we go. All right. Same thing here. I'm going to do it this way. Just relax your arm. Relax. If I drop it, it should fall. Relax. There you go. There you go. Relax, relax, relax. All right, that'll work. Next, we're going to move on to your patellar reflexes. So I'm just going to pull these up. Same thing here. Okay. Oh, nice one. All right, now your Achilles. So just try to relax. Good. This one too. Good. All right, last one. We're going to do your Babinski. Okay. Okay. Got those. We got the reflexes out of the way. I'm going to wash my hands really quick. All right. Next, we're going to test the vibration sensation. So this is a tuning fork. It makes vibrations. You can kind of feel them like that. I'm actually going to place it on your big toe, okay? So have your eyes closed, and I want you to tell me when you feel it and when you stop feeling it, okay? Feel it? Okay. Let me know when you stop feeling it. Very good. Same thing on the other side. You can feel it? All right. Let me know when you stop. All right. Good job. Okay, next up I'm going to test your sensation. Okay, so this is soft, this is dull, and this is sharp. So I'm going to test you on your face, and then we'll do a little on your chest, arms, and legs. Okay, so I just need you to keep your eyes closed while I'm doing this, and you're going to tell me what type of sensation you're feeling and where you're feeling it. Okay, so we'll start up here.
Dull on the left side,
Okay,
sharp on the right, soft on the right, dull on the left, sharp on the right,
good. I'm going to pull this down just a little bit so I can see your chest. Okay, so
sharp on the right, dull on the left, dull on the left, soft on the right, and soft on the left, dull on the right, sharp on the left, soft on the right, dull on the right, soft on the left, dull on the left, sharp on the left, soft on the right, dull on the right, soft on the left.
great. Good job. You can open your eyes. Next, what we're going to do is test stereognosis. So I'm going to place an object in your right hand. I'm going to have you hold it open with your eyes closed. I'm going to place it in your hand, and only with this hand you can feel, and you're going to tell me what you have in your hand, okay?
A coin.
Very good. All right, and I'll open your left hand, please.
A key.
Very good. Okay, you can open both eyes. Next, we're going to test your coordination. Okay, so we're going to have you do patty cake on your lap, and you can start slow, flip it up and down, and then go as fast as you can. Very good. Okay, now I want you to test the coordination of your fingers, so going one to the other, and then go as fast as you can. Very good. Next, we're going to test finger to nose. So I want you to touch your nose with your finger, and then touch my finger. You're going to go back and forth, first starting slow, and you're going to go a little bit faster. Very good. Now you can slow back down and do it with your eyes closed. Okay, open them back up, Now I'm going to move my finger, and I want you to keep up, okay? All right, very good. Now let's try it with the other hand. So just normal first, nice and slow. Gain your distance, okay? Good, now a little faster. Okay, now you can go a little slower, close your eyes with your eyes closed. Good, now open up. All right, we're gonna go different places. Get that coordination, very good coordination. All right, very good. We already did ankle pats, and we already did walking. So next we're gonna do the Romberg. So I'll have you stand up, feet together. All right, I just want you to stand there with your eyes closed. And we'll do this for 30 seconds. And 30 seconds has passed. Very good. Okay, open your eyes up. I want you to stand up with your hands out like this in front of you, a little higher up. Very good. And I want you to close your eyes again. Try to stand as still as you can. We'll do this also for 30 seconds. And 30 seconds have passed. Okay. And that completes the neurological exam. Thank you.
All right, well, that wraps up this video on the neurological exam. I hope you found it helpful. I hope you gained a few tips and tricks along the way. Again, there's more than one way to do things. This is the way that I do it. I'd like to share kind of my pointers and my perspective on things. There's definitely multiple ways to do it. So my way is not the only way. And if you have any things that maybe you want to share, any tips or tricks you've learned or success, things that you can share with your colleagues, be sure to comment down below because we'd love to hear back from you. If there's another video that you want us to make, also let us know. We want to make sure that we're putting out content that is helpful to you. And like I mentioned before, this is the last portion of the physical exam in this long series that we've been doing over the past few weeks. And so I hope this series has been helpful. I have one more video planned for you. I think this will be a special treat because I'm going to show you how to set up your patient encounter table. So we're going to have a little table. You set up all your equipment to help you succeed that way. I'm also going to give you some tips and tricks for helping with anxiety and other things. So be sure to stay tuned for that video. That will be the last video in this series on the patient encounter physical exam. Again, if you like this video, go ahead and give us a thumbs up and share anything you'd like with us in the comment section. Thanks again for joining, and I will catch you in the next video.